In the month of May comes the 4th annual National Neuropathy Week. The week highlights a disease little known among the general public, even though an estimated 20 million people suffer from some form of it. Our next guests are working to change that. Tina Tokarczewski is the Executive Director of the Neuropathy Association. Welcome, Tina.
Thank you.
And Dr. Alan Berger, Chairman, Department of Neurology, University of Florida College of Medicine, Jacksonville. Welcome aboard.
Thank you.
Together, they're here to help shed some light on a little-known and nearly invisible disease. So the problem is, it's one of the most common diseases nobody's ever heard of. And I understand it's like your body's electrical network going haywire. Can you explain?
Yes, the peripheral nerves carry the impulses from the brain to the muscles and the internal organs, as well as carrying sensory impulses from the skin and joints back up to the brain for perception. They allow you to control movement and to feel your environment around you. When the nerves aren't working, patients experience weakness and a loss of feeling, and many will have walking problems due to balance.
Now tell me what the symptoms are and what causes it.
The symptoms are multiple, and they can change from time to time. They may include sensory symptoms such as numbness or tingling, or painful symptoms such as burning and aching. If the nerves to the muscles are involved, the symptoms include weakness, cramping, and discoordination. And if walking is involved, then you may have imbalance of gait that can only be corrected by using your eyes to see visual cues.
And is there a cure?
Some neuropathies are treatable. That is, that the underlying cause can be identified and reversed. Examples of this is, for example, vitamin B12 deficiency or some of the autoimmune neuropathies. Other neuropathies, the cause is known but can't be reversed. And in many of the neuropathies, the cause cannot even be identified. But the important thing to remember is that even if a cause cannot be identified or reversed, treatment can still be instituted in terms of reducing symptoms, so that medicines can be used to reduce painful discomfort, or ambulatory aids can be used to help walking. So it's very important that patients seek treatment, even in those neuropathies in which the actual neuropathy can't be reversed.
So, Tina, what can and should be done about neuropathy by both the patients and by all of us?
Well, the most important thing for patients to know is there are resources out there to help. And if you feel alone, the Neuropathy Association is there for you. First and foremost, though, if you think you are experiencing any type of neuropathy symptoms, see a neurologist as soon as possible, and especially identify one with experience in treating peripheral neuropathy. After that, certainly come and reach out to the Neuropathy Association. Come visit our website. Join us, support us, become a member. We've got a lot of educational resources that are available. Our mission is to provide help and hope for patients living with neuropathy. We want to serve as a resource for education for those patients who are trying to become better advocates for themselves in their own medical care. We're providing additional information for physicians and healthcare providers so that they can, too, work with patients to best identify the symptoms and ensure proper care. We are also attempting to educate the general public, so again, they recognize the symptoms and can be sensitive to the dynamics of those who are living and managing with neuropathy. We are also serving as an impetus to encourage future research, whether it's encouraging others to dedicate more resources to finding cures in the future or through our own scientific grants programs to support scientists out in the field. We've got a national network of over 125 support groups, so there are local resources that patients can turn to. We've got 8 designated neuropathy centers across the country, in all regions of the country. They're listed on our website. And so glad to have Dr. Berger with me today because he is our center director down in Florida. Come to the Neuropathy Association website, www.neuropathy.org, to learn about any of these resources or some of the resources that are available in your local community. But we hope that patients will talk to their healthcare providers, reach out to us, support us, and join.
Tina, Dr. Berger, thank you both for joining us on Sky Radio.
Thank you.
Thank you.
Dr. Alan Berger is the chairman of the Neurology Department at the University of Florida Jacksonville School of Medicine, and Tina Tokarczewski is the executive director of the Neuropathy Association, and they joined us by phone. For more information about peripheral neuropathy, visit www.neuropathy.org.